In Module 16, we will cover the following content: how physical activity can influence functional and role ability, how exercise adaptations positively influence functional health, and the physical activity guidelines for promoting physical activity related to functional health, and the evidence behind them. Before we talk about this module, we may want to think of these two questions. What is functional health? How can functional health be improved to reduce the risks for physical disabilities? Here are two other questions we will discuss in class. First, at what age do many older people you know lost their functional health? Second, do you think regular physical activity helps maintain functional health longer? Why or why not? The prevalence of poor functional health is difficult to determine in any population because it is multifactorial and a variety of definitions exist. Then, what are the annual economic costs associated with falls and low functional mobility? It has been reported that the economic cost of fall injuries of those over 65 years of age in the United States, which are often due to poor functional health, exceeded $19 billion in 2000. As the elderly population continues to grow, it is expected that the costs will reach $54.9 billion by the year 2020. Here are the definitions for functional health and role ability. Functional health is a concept that suggests that an otherwise healthy person may have some form of functional disability and includes the maintenance of functional ability and role ability. Functional ability refers to the capacity to perform a task, activity, or behavior independently. Role ability refers to the ability to perform activities of daily living and instrumental activities of daily living. This figure illustrates a model that links the relationships among lifestyle behaviors, health status, exercise science principles, and outcomes such as functional health and peak performance. Basic functional health should be a primary goal for everyone. Beyond that, further participating in physical activity may lead to higher levels of performance. An understanding of basic exercise science principles is necessary for understanding how to maintain functional fitness, how to exercise, and how to face the challenges to maintaining physical activity, such as mobility challenges, medical management issues, and exercise rehabilitation challenges. For example, managing disease processes such as type 2 diabetes or maximizing the benefits of rehabilitation requires that people first maintain or regain their basic functional health. Only then can they optimize performance. Common risk factors for low levels of functional health are physical inactivity, low physical fitness, tobacco use, age, sex, and heredity or genetics. For example, being physically inactive for long periods of time reduces functional health. The basic risk factor for poor functional health is physical inactivity, existing or developing mobility challenges, medical management issues, and rehabilitation challenges further add to the risk. According to physical activity guidelines, the three primary risk factors associated with low levels of functional health are low aerobic capacity, a lack of muscular strength, and poor balance. In addition, cultural and social factors can affect functional health, including lack of social support. Simple tests of functional health address muscular strength, muscular endurance, balance, gait, and mobility. They are best measured using tests that focus on self-assessment or the assessment of a third party like a physician or researcher. These tests do not isolate one aspect of functional health like a muscle or joint, but rather, attempt to integrate observations into broad indexes of function. Some common tests are SF36 long and SF12 short, Functional independence measure measures physical and cognitive disability, functional assessment measure, and quality of well-being scale. Moderate levels of physical activity or exercise are associated with lower risk for functional and role limitations. The Physical Activity Guidelines noted moderate evidence that physical activity, at midlife and beyond, reduce the risk of moderate to severe functional limitations. There is also evidence that regular physical activity saves and improves functional ability. There is not currently enough evidence to show that physical activity improves or maintains role ability or prevents disability in older adults who already have functional limitations. Strong evidence suggests that participation in regular physical activity and exercise can prevent or delay function and role limitations and reduce the risk of falls in older adults by 30%. We are interested in the dose response between physical activity and prevention. How much physical activity or exercise is recommended to prevent loss of functional ability? Adults without disabilities should strive to achieve moderate intensity aerobic exercise totaling 150 minutes per week. Vigorous intensity aerobic exercise totaling 75 minutes per week or a combination of the preceding. And muscle strengthening activity for all major muscle groups at moderate or high intensity on 2 or more days per week. Adults with a disability who are not able to meet these recommendations should be encouraged to avoid inactivity by performing as much physical activity as they are able. They should discuss with their health care providers the type and duration of physical activity that are appropriate for their ability. Then, how much physical activity or exercise is recommended to prevent falls in older adults? To lower the risk of falls, exercise programs should include balance training and muscle strengthening activities 3 times per week for 30 minutes each session. Adding moderate intensity walking activities 2 or more other times per week is also recommended. Some evidence suggests that participation in Tai Chi 1 to 3 or more times per week may prevent falls.